Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of anatomy uh, on the topic lower limb with a subtopic of femur. So let's start.
Welcome to this lower limb anatomy examination. Let's begin. Can you describe the boundaries and contents of the popliteal fossa?
The popliteal fossa is a diamond-shaped, fat-filled hollow located between the knee joint, serving as a critical transitional zone for neurovascular structures passing between the thigh and the leg. Key contents include popliteal artery and vein, tibial nerve, common fibular nerve, and popliteal lymph nodes. The anatomical boundaries are semimembranosus and semitendinosus muscles, superolaterally biceps femoris muscle, inferomedially medial head of the gastrocnemius muscle, inferolaterally lateral head of the gastrocnemius and plantaris muscle. The roof is superficial fascia and popliteal fascia.
That's right. You've mentioned most of the boundaries and contents correctly. The floor is also formed by the popliteal surface of the femur, the oblique popliteal ligament, and the popliteus muscle. Now, telling me about the contents, which nerve is more superficial in relation to the artery and vein within the fossa?
The nerve passing through popliteal fossa is tibial nerve, common fibular nerve. These two.
Yes, that's right. The tibial nerve is the most superficial structure there. Now, speaking of nerves, what would be the functional deficit if a patient had an injury to the common fibular nerve?
I don't know, can you please explain?
The common fibular nerve supplies the muscles of the anterior and lateral compartments of the leg. Injury typically causes foot drop or an inability to dorsiflex the foot and evert the foot. Now, moving on, can you tell me about the boundaries of the femoral triangle?
Yes, the femoral triangle is bounded superiorly or the base by inguinal ligament. Laterally, there is medial border of sartorius muscle. Medially, medial border of the adductor longus muscle. The floor is muscular, formed by the iliopsoas and pectineus medially. Roof is fascia lata, cribriform fascia, subcutaneous tissue and skin. The apex is formed by intersection of the lateral and medial borders of sartorius and adductor longus.
Excellent. That's a very detailed description. You've covered everything correctly. Now, can you name the main contents of the femoral triangle?
The contents are femoral nerve located lateral to the femoral artery which is in the center, femoral vein, and then there is empty space containing deep inguinal lymph nodes, lymphatic vessels, and loose connective tissue.
Excellent. That's precisely right. Now, can you explain the concept of the femoral sheath and what it encloses?
The femoral sheath encloses femoral artery, vein, artery and vein, yeah.
That's partially right. It encloses the femoral artery, the femoral vein, and also the femoral canal, which contains lymphatics. Now, can you tell me which nerve passes through the femoral sheath?
The nerve passing through the femoral sheath is femoral nerve.
Actually, the femoral nerve lies lateral to the femoral sheath, not
It's
within
the
it.
genital branch
The
of the
nerve that passes through the
genitofemoral
lateral
nerve.
compartment of the sheath is the genital branch of the genitofemoral nerve. Before we conclude, let's discuss venous drainage. Can you briefly outline the pathway of the great saphenous vein?
The great saphenous vein drains in the internal femoral vein.
The great saphenous vein passes superiorly up the medial aspect of the leg and thigh and finally empties into the femoral vein in the femoral triangle. Well done. We've covered quite a bit today. Now, to complete the health and wellness part, please remember that this is an academic discussion and not medical advice or diagnosis. If you have health concerns, you should see a healthcare professional. Thank you. You may leave.